Good morning, ladies and gentlemen, and it's a really pleasure to be here. And in these 10 minutes, I hope I will take you through the short but journey that we have from primary healthcare. When we launched, from where we started to when we launched the telemedicine center and the electronic patient record IT system, and our hopes for the future. Okay, so our mission here, as you see, we at primary healthcare we have a multidisciplinary team with the doctors, nurses, allied physios, and we are all for making the system sustainable, needs-driven, cost-effective. Cost-effective is very important for Malta. Malta has a free national health service, so it is important that whatever we do, it will be cost-effective so that we can continue developing our needs and to make sure that everything that we do is patient-centric. Over here is this is basically how primary healthcare is spread across the Maltese islands. That's Gozo. We have, at the moment, we have 10 health centers, which are marked with a yellow circle. And in 3 of the health centers, we have 3 centers of excellence. One is for podiatry services, one is for the speech and language pathology service, and the other one just slipped my mind at the moment. And then we have 26 community clinics. These are 26 from the 55 community clinics that we have spread all over the island. These community clinics, until a couple of years ago, their function was used for prescription writing only. That changed with the COVID. We took the opportunity with the COVID to close the community clinics, revamp them, repurpose them, and we launched a new approach where we have doctors through the electronic patient record IT system are now connected with all the primary healthcare, and so the patient is really the center of our purpose, where the patient can roam to anywhere that they want, and they have their record is updated, and wherever they go, they can have their treatment would be according to their latest visit wherever they went, irrespective of whoever they've seen. Then we have the National Screening Center. We are responsible for the screening of the breast cancer, the cervical, and the colon cancer. And then we have the telemedicine center. We consider it as our 11th health center, the new edition, which was, as I will explain later on, it was launched very quickly, and we rode the wave of the COVID pandemic, and we launched the telemedicine. As I said, our main aim was and still is to position the primary healthcare to become the patient's automatic first point of choice. This we do, obviously, through the IT systems. We cannot do this unless we ride on the IT systems to be able to help us. 1, we use them as a social enabler so that we can communicate together, and 2, as the drivers, because we need data, we need to be able to map whatever we're doing, and as the drivers to later, where we're going into AI, IoT, so those will be our drivers for the future. And basically present and future, because we're already working on those. The transformation for the way forward is that basically we understand our present, so we know where we left, basically from a place that didn't have any IT system whatsoever. We understand the future. It's where we want to go. We want to improve our telemedicine. We want to develop it further. We want to go into AI. We want to go into IoT. And we want to be able to monitor patients from their homes, from the comfort of their homes, through the telemedicine center and other supporting stations. And this, obviously, we have to use the ICT to facilitate real-time visibility. We have evaluation, and this is the change. The change, it wasn't just changing from paper into IT, it was also an organizational behavioral change. And it was also a cultural change for the patient. There is there's no file missing at the moment, missing of results. So patients they are also aware of this change and they are benefiting immensely from this change. So what we're doing is really cost effective and is benefiting both the healthcare professional and also the patient. Basically, what I say to my team, because obviously this cannot be done without a team that backs you up completely, is that we must be also agile enough to change our course. And that's our little boat. So we're surrounded by sea, so we all know how to navigate here. Basically, it's the adage that we cannot control the wind, but we can adjust the sails. So COVID pandemic taught us a lot. It taught us that we can. This is really a reality that we really cannot change the wind, but we could adjust our sails, and so we did. Basically, these are the deliverables of our healthcare systems that we, through primary healthcare, we need to strengthen and prevent and increase our screening strategies. That is to try to be the gatekeepers of patients going into the hospital. Gatekeepers, it doesn't mean that we don't let people go to the hospital, but that the hospital will be used as it should be. Remember, I said that our healthcare is free, and patients can go and choose wherever they want to go. So that is why it is important that we continue to position primary care as the point of choice, because first we can reach patients better because we are basically everywhere. And secondly, timely care is less costly and more effective, and it helps the patient to stay in the community, into the place of work, keep on enjoying their lifestyle more. Strengthen our primary healthcare services for better patient access, and this is investing heavily in technology. That is primary because without technology, obviously, we are small, but definitely we need technology to make us more nimble and more agile to be able to connect. This is our business transformation from paper-based, completely paper-based in 2019, and to now in 2022, and basically in 2020, we became paperless, completely paperless. Our EPR IT system is part of Converge, which is an EU-driven project. It will obviously eventually be part of the National Health Project. I think I can say we were lucky in a way because COVID helped us. I was over here and I heard speakers before me in the panel saying how COVID has pushed things further. And this is what happened to us too. COVID helped us to push our ideas and make them happen, both for the patient and even for the healthcare professional. In Malta, as opposed to, for example, United States, we had a speaker saying about the United States. In Malta, we are small, and our culture is go in the car and go and knock on the door of the doctor, go into the health center, make an appointment here, make an appointment there. So it was important for COVID, where nobody could go out, everybody was restricted at home, and everybody was scared to go out. So telemedicine took off without, rode the crest, sort of, so to speak. And this is our trajectory. From 2017, we started with the tender and business plan. And then in 2019, we started in November 2019, it's not January, in November 2019, we started with the rollout of the telemedicine, of the EPR system. Version updates, and then in 2020, May, we were spread all over primary healthcare. That gave us the opportunity to introduce the telemedicine center, open the telemedicine center with a client support center, and now we will look forward. There's no looking back. We're looking forward with the integration to other systems, with the interfacing into the hospital systems, into other systems like the National Screening Center, and the new developments that we are working on already, as I said before, the AI and the Internet of Things. Over here, as you can see, we have a record which being a country of 500,000 population, that means this is the 2.66 million footfall in visits and calls with the EPR, with the electronic patient record IT system, the footfall in the health centers. 1.2 million calls for the client support center that pushes the extension of the telemedicine center. The telemedicine center had, since its inception, over 300,000 calls they managed through the telephone. So those are people that otherwise would have gone to the health centers. This is basically the telemedicine center also, we benefited from that in that 80% of the visits could be managed, of the home visits could be managed through the telemedicine center. So that gave also the opportunity for doctors and the health centers to be there, to be able to cater for more people who walked into the health center with sickness and asking for help. The social benefits of all this is we have, as already mentioned, we have an aging population that the telemedicine center over the phone, it's ideal, so they don't need to roam around. We have the migration problem, unemployment, because it creates also opportunities for other people and more jobs. It also brings closer the social divide and any instability with patients who can't walk, who do not have support in their home to be able to come to the health center. So the telemedicine center and the electronic patient record make this very, very simple for the patients to have a holistic point of care. Poverty and the culture, it comes with that too, and the cultural diversity, because over the phone, we have basically we're multilingual as well. So in Malta here, language is not really all that much of a problem. These are the salient initiatives that we have in hand, and our future plans are in the yellow box. Basically, we're working towards a voice recognition for medical notes so that we make it easier for the doctors and for the healthcare professionals to record the patient in the patient history. The voice analysis for patient in telemedicine and support so that we could be able to recognize the patients. Language translators for foreigners. Additional equipment, and as I said, what we're looking into the AI with glucose monitors and ECG patches, and this is what we're working on for the very near future. Our achievement didn't go unnoticed. Basically, this from December 2020, we achieved, I'd like to share with you, because this is really important for my team and for the health ministry, that our idea, our initiative got us the e-business award for the best use of technology in business transformation. We got the National Supporting Business Award. We came runner-up over there. And we were also nominated for the World Summit Award with the electronic patient record, which is, for us, it was really an honor to be able to reach that kind of level. In conclusion, basically, investing in the primary healthcare ICT infrastructure and resources is crucial for our national health care system. That is to remain sustainable, and I'll close with what I started, accessible and equitable, and simultaneously provide a better quality of life for the present and future generations, which is basically the key to why we all work, and we rise up in the morning and we go to the office, sleep there almost, and wake up and dream for the future. I thank you, and I thank my team for supporting me, and the Minister for supporting us in our drive. Thank you for listening.